Hi everyone, my name is Elise Annabel and I'm going to talk to you guys a little bit about the disease cholera or Vibrio cholerae and give you guys a basic overview of the key components of this disease. So I just wanted to start off with a little bit of the historical perspective of cholera with some key pandemics of this disease. So it is unclear when cholera first became prominent, but there have been texts from India from the 5th century BC and Greece in the 4th century BC reporting isolated cases of illnesses that resemble cholera. There are 7 known major cholera pandemics on record. The first cholera pandemic occurred in 1817 from the Ganges River in Jessore, India, and was caused by contaminated rice. The disease spread through much of India, Thailand, the Philippines, and eventually Turkey, Syria, and southern Russia. So these two maps right here are a pretty accurate representation of where the disease spread. So this is a good overview. It shows Asia, Turkey, Syria, Russia, and then this one is a map of the spread through India specifically. The pandemic lasted about 6 years, and it is suspected that about 1 million people died during this time frame. Again, this is like an estimated number, as many sources over and underestimated the number of deaths. It is presumed that Robert Koch and his principles of modern germ theory are to credit for the official discovery of cholera, although there were many other sources before who could be credited with the discovery of cholera. So Koch did this by inoculating samples of fecal matter from various patients and was able to grow and isolate the bacteria on agar plates. So now I'm going to talk a little bit about the incidence and prevalence of cholera in the US. Cholera is very rare in the US today because of the modern water and sewage treatments available. Practically all of the cholera cases that are reported in the US today were acquired from international travel to places such as Africa and Southeast Asia. In some cases, cholera is contracted through contaminated seafood that is brought to the US. The Cholera and Other Vibrio Illness Surveillance System, or COVIS, is a data system created by the CDC, FDA, and Gulf Coast states to monitor the illnesses associated with the Vibrionaceae family within the United States. These two tables include data from that system. In this table, the total of cases from Vibrio cholerae or cholera was 80 in the United States in 2014. This second table here includes a little bit more information about some of the cases. It includes age, sex, if they were traveling internationally, and where they were traveling. So it's important to note that in all of these cases, it was from international travel outside of the United States. Transmission and cause. Cholera is generally spread through food and water, which has been contaminated with the bacteria. For example, through feces that has been contaminated in the drinking water. The mode of transmission for cholera is the food-oral route. Cholera outbreaks generally occur in places with insufficient water treatment for sewage and drinking, inadequate hygiene, and poor sanitation. Raw seafood, fruits, vegetables are also prime causes for cholera, as they can transfer the bacteria to the host if the food is not cleaned or cooked properly. Symptoms. The symptoms of cholera include diarrhea, nausea, vomiting, dehydration, electrolyte imbalance, which can lead to muscle cramps and shock, low blood pressure, rapid heartbeat, loss of skin elasticity, sunken eyes, and dry mucous membranes, which in many cases have been linked to dry mouth. Patients have also reported flecks of the mucus layer of the intestine in their diarrhea, along with high amounts of sodium and potassium. This picture here shows the symptom of the sunken eyes. This one shows the muscle cramps, and this is low blood pressure. Diagnosis. The diagnosis of cholera is typically done by taking a stool sample from the patient and growing the bacteria on thiosulfate citrate bile salts agar plates, or TCBS, which is shown in this picture here. This is generally the gold standard for diagnosis because the bacteria can be grown, isolated, and identified. However, for countries that do not have adequate laboratory testing methods, the Crystal VC dipstick rapid test, which is shown here, can be used to quick diagnose cholera. The test detects the cholera strain specific antigens in the human stool samples. However, the sensitivity and the specificity of this test is not ideal, so traditional culture-based methods are recommended to confirm a diagnosis or a mixture of the two. Treatment. Rehydration therapy, intravenous fluids, antibiotic treatment, and zinc treatments are the prime ways to treat cholera, according to the CDC. So rehydration is highly effective if it's administered on time, and it has reported of saving up to 99% of cholera patients. The therapy involves a high volume of oral rehydration salts, or ORS, which gives the body a necessary amount of salts for rehydration. Although rehydration salts can be administered in a hospital setting, I believe they can also be made at home with a few ingredients that are generally common in a household, such as salt and sugar. Some other treatments include intravenous or IV fluids and electrolytes. Typically, IV fluids are administered to the patients with the most severe dehydration or are undergoing shock. And while there are quite a few antibiotics that are used to treat cholera as well as combat the symptoms, the most effective and beneficial are tetracycline, doxycycline, which is safest for pregnant women and children, and the antibiotic azithromycin. However, it should be noted that the mass distribution of prophylaxis for asymptomatic individuals as a form of prevention has caused some people to acquire a resistance to the antibiotics. So antibiotics should really only be used in the most severe cases of cholera. It has been found that zinc supplements have shown a faster recovery time for patients and have reduced the severity of diarrhea. In fact, it has become a recommended form of treatment for pediatric diarrhea, which I think is pretty cool. Prevention. The most effective ways to prevent cholera are by washing your hands thoroughly with soap and water, trying to use clean water when brushing your teeth, preparing food, or making ice. The best ways to make water clean is by boiling the water or using a chlorine product. You can also use household bleach to add to the water, but no one really wants to drink a Clorox on the rocks. So the other two methods are much more ideal. Cooking certain foods to the right temperature, along with washing and peeling fruits and vegetables, can help prevent cholera by killing and getting rid of the bacteria on the food. Getting rid of human waste properly is also another component in the prevention of cholera, in order to avoid contaminating water supplies and decreasing the spread. Along these same lines, water treatment and overall proper waste disposal is a huge key component in the prevention of cholera. these are the references that I use for this presentation. Thank you so much for watching. I look forward to any questions that you guys might have for me. So yeah, bye.